Hi, welcome back. Today we are going to see an important topic which is mostly tested in NCLEX, that is the infection control, which is a very high yield topic. So most of the questions are tested from this particular topic. So the modes of transmission, this is the main important thing what we have to see. It is a direct contact. It is from person to person. Indirect contact, it is with contact with contaminated surfaces by another person, or an airborne infection which the pathogens which is present in the air, and the droplet infection, the pathogens are present in the droplet form, the vector borne where the infection is being caused by insects or the animals. Here, how we can remember the droplet? It is the Spider-Man. Think of Spider-Man wearing a mask. He is wearing a mask because he is going to protect it from the droplet infection. So here, the Spider-Man, we have a mnemonic, that is S for sepsis. It is mainly caused by the meningococcal infection. It can cause meningitis. And P is for pneumonia, mycoplasma. It can cause pneumonia and a pneumococcal pneumonia. And I is for influenza. It's a type of virus. It can cause influenza virus. And D is diphtheria, which can cause diphtheria in pharynx. And E is for epiglottitis. Again, this is caused by this particular droplet infection. And R is for rubella infection, and this is caused by again the rubella virus. And M is for mumps, which is caused by which can cause mumps in the patient. And A is for adenovirus, where it can cause the adenovirus infection. And N is for Neisseria meningitidis, it can cause meningitis. What we must remember in an NCLEX point of view, we should wear a surgical mask, and we have to keep a distance of 3 to 6 feet. And the patient is in private room, and door can stay open here. And the transport, the patient wears a mask, and here he wears a simple mask, not the N95 one, because it is a droplet infection, not the airborne, like a TB. The next, the quick NCLEX trap, what we should remember is, if a child says the child is having a barking cough, think of epiglottitis, droplet, that is a flu-like symptoms plus fever. So it is a droplet, it's not TB. Next is coming to the airborne precautions. We have to remember with the mnemonic MTV. MTV in the air. Think you need a special room because it floats in the air. Yes, MTV. Here, M is for measles, T is for tuberculosis, and V is for varicella. That is a chickenpox. The room is set up. And here the air has to be maintained in air pressure negative room, where A is for airborne infection, isolate room, and I is for independent airflow, and R, we have to give a respiratory N95 mask for this particular type of patients. The NCLEX trap reminder is, surgical masks we should not give. We should always give a N95 respirator. And negative pressure room has to be maintained, and the door has to be remain closed always. And next, coming to the contact precaution, we are going to remember with the Mrs. V. Think if you touch it, you will catch it. Yes. M for MRSA, R for RSV. That is M for methicillin resistant staph aureus, R is for respiratory syncytial virus, S for scabies. V is for wound infection, any major draining wounds. E is for enteric infection, that is Clostridium difficile. And E is for resistant organisms. Yes. The main memory act, what we should remember in contact precautions is, we have to wear a gown and the gloves before you touch the patient. What we must do? Yes, gloves, and a private room if it is preferred. And hand washing with a soap and water in case of a Clostridium difficile type of infection. And coming to the skin infections, what we have to see? We have to always remember with a mnemonic 3 I's of the skin, that is impetigo, incisional wound infection, infected cellulitis. Think, if it is red, warm, swollen or oozing, it is one of the 3 I's. Yes. A super easy memory trick is, if it is oozes, we should use the gloves. Most infection we have to use the contact precautions. Another high yield mnemonic what we can remember is, the scary Mrs. V has a bad skin. From the contact precaution list, S is for scabies, C is for Clostridium difficile. It is enteric but it is contact. Yes, and A is for abscess and R is for respiratory syncytial virus, mainly kids where they have skin contact, and Y is for just for a memory hook. It doesn't have any abbreviation. Mr. V, Mrs. V is MRSA wounds, enteric and other organisms. The NCLEX trap is, if it is draining, then it is a contact. We have to opt for a covered wound. We have to use gloves and we have to practice a hand hygiene, and mask alone is not enough, and airborne room is not required in such type of patients. So this is all about the small topic infection, how we have to follow this particular steps when we are caring for the patients. Thank you and happy learning.